So you've probably heard someone say, I've got a slip disc. It might be a phrase that you use yourself. It might be something that a doctor has told you. But what does that really mean? Can a disc slip out of place? Is it a serious, a dangerous problem? And what's actually causing your back and leg pain? So to understand disc injuries, we need to understand exactly what a disc is and what it does so we can understand what is happening when it all goes wrong. I'm Dr. Rob. I'm a chiropractor with over 20 years of experience. And if you've got a pain, I've got the answer. So what even is a disc? Between each bone in your back is a spinal disc. And this is made up of two parts. A tough outer ring made of collagen called the annulus. And this is made up of lots of layers that are crisscrossing against each other to provide the strength, and it's composed mostly of collagen. This contains the softer gel-like center, which is mostly water, and that's called the nucleus. The discs are like mini shock absorbers. They allow us to bend and twist, but they help protect the bones and the nerves. Now here's where the problems can start. So if you have a repetitive strain-like injury through your disc, or you lift something too heavy and you damage the outer casing, the inner part of the disc can start to break through those layers. When that happens, you get a disc bulge. If it pushes all the way through and actually sticks out of the disc, we call that a disc herniation. That disc bulge or disc herniation itself doesn't cause pain. The effect it can have, which is cause inflammation, or if it touches a nerve, that can lead to a lot of other symptoms: pain, pins and needles, tingling, or numbness. Those symptoms often aren't where the disc is actually damaged, but they follow the path of the nerve. So in your lower back, they will often shoot down your leg, or in your neck, they will shoot down your arm. And no, it is a myth. A disc cannot slip out of place. It is firmly lodged where it's supposed to be, attached to the bone above and the bone below it. However, it is the disc bulge or the disc herniation people are referring to when they say they've got a slip disc. So if your disc bulge itself is not causing you pain, why are you in so much pain right now? Well, that's because the disc is most likely touching one of the local nerves, and that is causing direct pressure onto the nerve, and we call that physical irritation. It's also causing swelling, and the chemicals that are in swelling cause chemical irritation, and that causes damage to the nerve, specifically to the outer casing of the nerve called myelin. If that is damaged, then the signal along the nerve gets confused and the nerve will often misfire, and you will feel things that are not actually happening to your body. And that's why you get those symptoms that run down the leg, often as far down even as your foot. It's not about where the bulge is, it's about the nerve it touches and where that nerve travels to. That will outline most of the symptoms you're getting. And as clinicians, we can use those exact pathways of your pain, those exact symptoms you're getting, to map out which nerve it is that's trapped and what we need to do to help untrap it. So what can you do at home to help your disc bulge? Well, the first thing I'm going to suggest to you is stay mobile. I know you think rest is probably going to help your disc, and to a degree, yes, I don't want you to be doing any heavy lifting or any strenuous exercise, but gentle walking, gentle movement helps to loosen the nerve off, helps to take the pressure off of the disc and allow some of that swelling to come down. Ice is really useful as well. Putting it over the area of the spine that's affected for 10 to 15 minutes is a really good way of bringing your swelling down and numbing the pain. If you can't stand 10 to 15 minutes of the cold on you, do 5 minutes. A little bit is better than nothing. The next thing is hydration. Try to make sure you're having enough fluids. As I mentioned earlier, a part of your disc is mainly water, and the discs need that water to stay springy. So keep your fluids up because it will help keep your discs healthy. Next, try and keep good posture. Try not to slouch and try not to sit for too long. These positions will really increase the pressure through the discs, specifically for your lower back. So keep moving, keep active, and don't stay in one position for too long. And lastly, nerve glides. Nerve glides are a gentle way to mobilize your nerve without putting too much strain through your body. If you're interested in doing nerve glides for sciatica, I've already got some of those on here now. Go check them out. If you're looking for ones for arm pain, I will be making some of those very soon. So when should you get some help? Well, if you've had your pain for more than a few weeks, or if the pain is getting worse, or the other symptoms are getting worse, please go and see someone as soon as you can. I'll be happy for you to see anybody, but obviously as a chiropractor, I would highly recommend going to see a chiropractor. We are specializing in spine problems and nerve problems, but if you prefer to see a physiotherapist, osteopath, or even talking to your GP, get someone who can examine you and find out the root cause of your pain. You may think it's coming from one area, but it may be coming from another. Once we know exactly where it's coming from, we can target the correct treatment for you, whether that's chiropractic adjustments, mobilization, massage and muscle release work, or disc decompression therapy. But here's some good news. Discs do heal. In fact, multiple studies have shown that disc herniations and disc bulges can heal and actually reabsorb over time. With the right movement, care, and a bit of patience, many people get significant relief, even full recovery without any surgery needed. The key is consistent, targeted treatment and rehab while your body does the rest of the work. Most discs don't need surgery. They need time, care, and the right strategy. Your body can reabsorb bulges and your pain can die down. And the more you understand it, the more control you're in. If this has finally helped you understand what a herniated disc is and why it hurts so much, please hit like and subscribe. Pain is confusing, but it doesn't have to be. I'll continue to break things down in plain English so you don't have to guess what your body is trying to tell you. So remember, I've got your back. Literally.